Good morning.
Hey, good morning.
Good morning. Okay. So we studied respiratory system yesterday. Okay, so what happens? We studied this yesterday. Okay, so tell me the organs. Starting from here, nose. Then this is larynx. Right here. Lungs. Okay. Bronchioles. And these are the alveoli, the air sac. Okay, so you studied this yesterday. Okay, so what happens? The air goes through the nostril, okay, and then we are able to speak because there is larynx here, okay, around the trachea. So when this air passes, we are able to make different kind of sounds, and we are able to speak, we are able to communicate, and we can make different kind of sounds, something like that we can make. Okay, then this is trachea, or trachea is also called windpipe. Then this trachea, it gets divided into two branches because we have two lungs. So this is bronchus, but together they are called bronchi. Okay, then this is left lung, this is right lung. In this, then this one, each bronchus, it gets divided into different branches called bronchioles. Okay, and each bronchiole, it ends at alveoli. Alveoli is the air sac. So in this alveoli, the gaseous exchange takes place. Like say, this is the alveoli, and then there is an artery. Okay, this is the capillary. Okay, this is the capillary. Here we have O2, here we have CO2. So this CO2 will go inside and O2 will come inside. Okay, this is the alveoli and this is the capillary, blood capillary. So this is the exchange of gases. Exchange of gases. Yeah. So in the alveoli, this carbon dioxide goes inside, and this oxygen, it comes to the capillary blood vessel. I hope this is very clear. Now, this here, diaphragm. Okay. It's a muscle. So what happens when we breathe in? Okay, inhalation. The lungs will expand in all the direction. It will expand in all the direction. So also downwards. So when it goes downwards, actually this diaphragm helps. The diaphragm will go downwards so that the lungs can expand. Okay, and we also have rib cage here. And in between, we have intercostal muscles. Okay, so when lungs expand due to inhalation, these are the two factors that help in expansion of lungs. That is the rib cage. In the rib cage, the bones do not move. The bones are moved because of these intercostal muscles. On their own, the bones do not move. They need some support, and that support is given by the muscles. So in between those rib bones, we have intercostal muscles which help in the movement of the rib cage so that the lungs can expand. And the other one is diaphragm. Okay, that in diaphragm, it during inhalation it goes downwards, it contracts, and then it goes back to its original position. Okay, so yesterday I drew a diagram of like 3 diagrams of lungs. So this is normal. Suppose this is normal condition of lungs. Okay, you can take screenshot if you want. Okay. So here, so you see, this is the situation during inhalation. This is normal, and this is exhalation. So you see, during exhalation, there is still some reserved air in the lungs. It does not collapse. Okay, all the air is not expelled out, because if that happens, then it will just collapse and it will be difficult to open again. So it is always, it always stores some reserved air in the lungs. Okay, so when one exhales, the size of lungs becomes smallest. Okay, but when we in yogic practices, in yogic deep breathing, we try to expel as much as we can. Okay, don't worry, your body will help you. It will always keep some reserved air. It will never allow your body to expel all the air out. Okay, so in yogic deep breathing, we have to try to exhale out as much air as we can. Okay, this is exhalation, this is inhalation, in which the size of the lungs has been expanded in all the direction. Okay, when we inhale, the chest expands, the abdominal expands, and this clavicular region also, it goes a little bit upwards. Okay, so this is inhalation, this is normal, and this is exhalation. If there is any query, please ask. And you can take screenshot. Okay, we can move forward. Okay, so functions. Tell me, what are the functions of respiratory system? It has a lot of functions. I have told you a few while explaining. Please tell me. Please tell me the functions of respiratory system. No one is interested. Ronnie and Jean, please tell me the functions of.
The Wi-Fi was really bad yesterday, so we didn't get this lesson.
Okay, you didn't get, but you can still tell me the functions of respiratory system, because I have told you what all is there in respiratory system. So just by common sense, please tell.
It's to supply oxygen to the body.
Yes, very good. Yes. Supply oxygen. Yes. Next, similar to this.
To extract the toxins from the
Extract
egg
the-
cells. The toxins.
Yes, expel out the carbon dioxide. Okay, very good. And I told you about larynx. Voice box.
Yeah, to use your larynx and your voice cords
Yes. So what does it help you in?
to use your voice cords and to have a voice.
Yes. So it helps in vocalization, speaking. Okay. Yesterday, I gave you an example. We use perfumes.
Yeah.
How do we know different perfumes?
Due to our smell organ.
Yes, we can smell through our nose. Okay. These are some common ones. Now, I'll tell you some technical ones. See, sometimes if we go to Rajasthan, you know Rajasthan?
Yes.
Sahara Desert. Okay, we go to Sahara Desert. Okay, so a place where it is very dry. Like in Delhi also, it is very, very dry during summers. So what happens if that dry air goes inside? What will happen? Your lungs will get very dry. Okay, which is unwanted in the body. We do not want that our body feels very dry. Okay, that's why we have mucus in the nostrils, so that when the air comes, the function of the nose is to make that with that dry air humidify the dry air. So the function is humidify the air. Okay, so whenever, like, this is the our body is so perfect. Wherever we go, we have a feature that can adapt to that situation. See, if it is dry air, then the mucus will humidify the air. If we go to cold region, okay, if we go to Himalayas, then it is very cold. Okay, the air around is very cold. Okay, so if you inhale that cold air goes inside your throat, then you get cough, then the cold air travels through your lungs, that person gets pneumonia. Okay, but that does not happen because our body functions so well. It is well coordinated with the environment. So what happens? This our nose will try to warm it. So it is warming the air. Okay. Now, there is a situation. Suppose we go to a place and there is dusting going on. Okay, they are cleaning, like there is dust around. Okay, you go to a room full of dust. Okay, because the cleaning is going on. What happens? Please tell me. If you enter a room and there is so much of dust, you like,
You cough.
what happens?
You start coughing,
Coughing and
sneezing.
yes. So why we are sneezing? Because now our body has received a signal that there is so much dust. Oh God, we do not want that dust inside our lungs. So what will it do? It will
Filter.
sneeze. Huh?
Filter.
Yes. So very good. So what will happen? It will sneeze. And when you sneeze, a lot of mucus comes out. So that mucus will absorb all the dust particles. It will filter out. Okay, so that that dust will be trapped in the mucus so that it does not go inside your lungs. Okay. It traps the dust particles. So it filters the air. Yes, anything else? There is also this concept of, since it is because of this, it also balances the pH of the body. Okay, these are the most important functions of respiratory system. You can take the screenshot. Okay, now we'll study the disorders. Lung cancer. Okay, so you see the disorder of respiratory system generally they happen because of smoking, or if somebody stays in a place where there is a lot of dust particles, like some people work in cement factory, or suppose in cotton factories where cotton is manufactured, like processing of cotton happens. Okay, so this kind of factories, if people work, they get this lung disorders. So like in lung cancer, what happens is the epithelial cell so there is chest pain, shortness of breath, due to shortness of breath, the person feels very tired. He's unable to function well. He's unable to do a lot of exercise. Then you see, if any type of cancer is diagnosed, if not just cancer, but if any disease is diagnosed early, it can be cured. But if it becomes very chronic, means it has been there for years and years, then it is very difficult to cure. So it is always advised that we should keep our body in check. We should do regular checkups like blood test, and if there is any pain in the body, we should visit doctors and get ourselves cured. Because if we keep delaying our problems, like if there is a problem and we keep delaying, okay, we'll go tomorrow, then it does not help. It will become chronic and it will be difficult to manage it. Then there is another disease called asthma. It is very common in young kids, like up to 5 years. What happens in asthma is basically one is not able to breathe out. The muscles, the ribcage muscles, they become stiff. They are not able to move. So the person is not, see, if the person is not able to exhale, he will not be able to inhale because there is still some air. But if you inhale, okay, you hold it, but then you want to breathe out. Why? Because the oxygen has been utilized and you want fresh air. Yes, but in asthma, the patient is not able to breathe out. Okay. And if he's not able to breathe out, then we have one practice in yoga, that is Kapalbhati. In Kapalbhati, what happens is the person is forcefully exhaling. Okay, there is forceful exhalation. So it's a if there is a patient who has asthma, if there's a person who has asthma, then he should practice Kapalbhati pranayam. Kapalbhati. Okay, Kapalbhati pranayam. In that, there is forceful exhalation. Okay, we are training our body to exhale forcefully. Yes, because it is mostly focusing on exhalation, exhalation, exhalation. There is no inhalation. That happens passively, but actively we are only exhaling. Okay, so if anyone is suffering from asthma, so when that person is in normal condition, he is not having that asthmatic attack. When he is normal, that time you teach him Kapalbhati pranayam so that his body is trained to exhale. Okay, so asthma can happen these days we have a season of the flowering of mangoes. So during this time people get this attack, they get little bit cough and cold, and they get some allergies. Okay, they get allergy due to pollens and dust, like whatever, if there is any pollen in the air, like these days in India we have mango season coming up, so there is a lot of pollens of mangoes, so that it gets very allergic for that person. So they have to keep okay. Then we have bronchitis. In bronchitis, what happens? The bronchi I talked about. See, this is trachea. In bronchitis, this bronchi, they get inflamed, due to which there is a whizzing sound, and there is like these are inflamed. Okay, because of which the person is not able to function its respiratory functions properly. So that's called bronchitis. Okay. You can take screenshot of this. Okay. So let's start a new topic of types of bones. We have axial and appendicular. In axial, we have head. We have vertebral column. And we have thoracic region. Thoracic cavity. In appendicular, we have limbs, which are arms and legs. And then we have pelvis. And then we have shoulder. Okay. Yes. So these are mainly the bones can be classified into two categories, which is axial and appendicular. Axial is the head, the vertebral column, thoracic cavity. Then we have appendicular. In appendicular, we have limbs, that is arms, legs, pelvis. Pelvis is the hip region. And the shoulder. Okay. So this head is again divided into cranial and facial. Vertebral is divided into cervical, then thoracic, sacrum, and coccyx. Okay, this is C1 to C7. This is T1 to T12. Lumbar is L1 to L5. Sacrum is 3 bones fused into 1. Coccyx is 1. Okay. Then thoracic cavity, we have rib cage, in which we have 12 pairs, and we have sternum. This is also 3 bones fused into 1. So we studied the concept of adult having 206 bones. A child has 300 bones. Why? This happens because these bones, they start getting fused as the person ages. The bones, they start getting fused. We see example here, sternum. In sternum, at young age there are 3 bones, but as one person ages, these 3 bones fuse into 1. In sacrum also there are 3 bones in a child, but as he ages, these 3 bones are fused to become 1. Okay, now I'll tell you one concept, that a child is more flexible than an adult. Why? Okay, here you see. This is my finger. Okay, if there was just one bone here. I'm able to move only this much. Okay. But I have 1, 2, 3, 3 bones here. I have 2 joints and through which 3 bones are connected. So I can move this and I can also move this. So now my flexibility has increased because of 3 bones. But if there is only 1 bone, then I can move only this much. But when there are 3 bones, I can move this much. See, you see the difference? Now you understand why a child is more flexible than an adult. A child has 300 bones, but slowly and gradually those 300 bones become 206 bones because they start getting fused. Example of that we see in sternum. Sternum is here in the middle. Okay, here. So in sternum there were 3 bones, and in an adult they get fused to become 1. Similarly, in sacrum there were 3 bones and they fused to become 1 bone. Okay. In head we have total 22 bones, and how 22? Cranial are 8 and facial are 40. Okay. So now we see cranial 8 bones, facial 14 bones. In vertebral column, we have C1 to C7, that is 7 bones here, 12 bones here, in number 5 here. 1 this and 1 this. Okay. You can take screenshot, please. Okay. Any confusion up till now?
No, it's clear. Thank you.
Okay. Okay, now cranial bones. These are 8 in number. Frontal, then parietal, sphenoid, ethmoid, temporal, and then occipital. So these are in pair, this parietal and temporal. So total we have 1, 2, 3, 4, 5, 6, 7, and 8. 8 bones in cranial cavity, cranial bones. We have 8. Okay, so frontal is this. This is frontal. Okay, you see, you touch it and you feel this is 1 bone, and then you feel something is here. You feel different. Okay, somewhere here you feel different because this bone has ended. Okay, now this is parietal, this bone is parietal, and this is temporal, and here at the back is occipital. Okay, these are responsive. Okay, the bones. Okay, so here, suppose this is frontal, this is parietal, and here we have temporal. Okay, so you see the skull, it feels like just 1 bone, but it is not 1 bone. Okay, it is several, it is we have studied 8 bones, but we do not feel. Why? Because the joints in the cranial bones is immovable. Like you can move your shoulder like this, you can move front, you can rotate it, you can do so many functions with this joint, but the joints in our cranial bones is immovable. It does not move, and you do not want it to move because it is protecting a very, very significant organ of our body, which is brain. So you do not want your brain, you want to protect your brain. So all the bones are connected very nicely, and they do not move at all. And this joint is called suture. Okay, these bones, the joints of cranial bones is called suture. Okay, this. Now you see the brain. Okay, it has to receive blood so that it receives all the nutrients, oxygen, and it can send away the carbon dioxide. Okay, how will it do? Because this cranial cavity, it has very immovable joints. Okay, so there are some holes in the cavity. Okay, not in this bone, but yes, it has some holes, and those holes are called foramina. Okay. Foramen magnum is the largest hole, okay, through which spinal cord is coming out. Just hold on.
Largest hole where spinal cord goes out?
Yes, through which the spinal cord goes down. Okay,
Goes
here
down or out?
goes out. Yes. Okay, so I'll share with you a picture. Okay, so here we see frontal, this yellow is frontal, then this pink is sphenoid, then we have ethmoid, then we have occipital at the back, temporal on the sides, parietal is on the top. Okay, so there are 8 cranial bones: sphenoid, ethmoid, occipital, temporal, parietal, and frontal. Okay, you can take screenshot of this. Okay, please take screenshot. Okay, now we have facial bones. which are 14 in number. Okay, in that we
Can you
have
stop
nasal.
screen sharing so we can see the board?
Oh, yeah.
Thank you.
So we have nasal, we have lacrimal, inferior, nasal, concha. We have maxillary, we have mandible, we have palatine, we have zygomatic, and vomer. All these are in pair of two, except mandible and vomer. Of all these are the most important ones, maxillary and mandible. Okay, you can take screenshot of this, or I'll just share with you a picture in which you can see all the bones. And so yes, so here we see there are 14 facial bones. So two are nasal. This skin color bone in pair is called nasal bone. Then we have lacrimal bone. This bottle green color that we see is lacrimal. Then we have inferior nasal concha in pair, this green color at the tip of the nose. Okay, then we have maxillary in pair. Okay, maxillary is in pair. This is important because here our teeth, our jaws are fixed. Then we have mandible. Mandible is the movable bone. Okay, here this, because of this mandible, we are able to eat, we are able to talk. Okay, then we have vomer, zygomatic, where we put our highlighter, and palatine, a very small bone we have. So I'll erase them. And yes, please take screenshot of this. And please tell me, which is the smallest bone in our body? Cancel. Yeah, stop sharing. Yeah. So tell me, which is the smallest bone in our body? Please tell me the smallest one in the body. Any guesses? Wild guesses. It's okay if you do not know the answer. Just guess. Ki somewhere here it must be having.
Is it one of the cranial bones or facial bones?
Cranial, facial. Okay, it's not the cranial bones because we clearly saw they were big enough. If you could guess, you could guess somewhere here that we the bone we had, but that is not the answer. The answer is the bone in the ear. Okay, we have 3 bones in the ear. Smallest is stapes. Okay, so if the smallest bone in our body is in the ear. Okay, now that was difficult to guess. So like if you know it, then only you can see. But now, next question, you can just look at yourself, feel your bones, and you can tell which is the largest bone, the longest one of the body.
Femur?
Yes, very good. Yes, that is longest bone of the body. Okay, so let's move forward and talk about vertebral column. Vertebral. It's also called spinal column or spine. Okay, this vertebral column is very important to our body. वैसे तो every part of the body is very important, but this has more significance. We need to protect it more. Why? Because spinal vertebral column is protecting our spinal cord. Like rib cage is protecting the lungs. Similarly, vertebral column is protecting the spinal cord. Okay, and spinal cord is very essential because it is sending the nerves to all the body parts from the brain. Okay, the spinal cord starts from the brain and then it reaches to the hip region, and it is an extension, okay, of the brain. Extension of the brain. It works like a personal assistant to brain. If brain is busy in some other work, it delegates its work to the spinal cord. Okay, like suppose if I suppose this is a safe tip here, so my reflex will be I remove it, I remove my hand immediately. That reflex action happens because of the spinal cord. The brain, that signal does not reach the brain, it reaches the spinal cord. Okay, and the spinal cord gives the signal, okay, this is hurting you, so remove your hand from there. Right, so the spinal cord, it is divided into cervical region, thoracic, then lumbar, then sacrum, and coccyx. This has 7 bones, this has 12, this has 5, this 3 fused into 1, coccyx is 1. This is the tailbone. Okay, I'll show you a diagram of it. Okay, so here we see cervical vertebrae. Okay, it's in the neck. Okay, you see front view and side view. So okay, this here we have 7 bones, C1, C2, C3, C4, C5, C6, 6, 7. Okay, here this starting this. These 7 bones, these are the cervical region, and they send the signals to your arms. Okay, it is related to your neck and your arms. Then we have thoracic vertebrae, T1 to T12. Okay, these are these 12 bones here. Okay, so these 12 bones, they are sending nerves to your lungs, to your rib cage, and your heart. Then next we have lumbar vertebrae. This lumbar vertebrae is your backbone, like your back here. You see this your lumbar region. Okay, it has 5 bones. And then we have sacrum. These are the 5 fused vertebrae. And here is and this sacrum. And then the last we have coccyx. So this is sacrum. This is sacrum, and this is coccyx. Okay, you understand? And we see that as we go downwards, the size of the column of the vertebral column is expanding, because as we go down, there is a lot of weight that a vertebral column has to tick. Okay, because we have here in this region, we have only head. And then as we go downwards, the weight on the vertebral column increases. So that's why to sustain that weight, we have larger size of vertebral column. I hope that is very clear to you. I will erase everything. And now you can take the screenshot, please. Yeah. So you can, I hope, so types of bones are getting clear to you. We'll continue this on Monday. So I hope things got clear. If there is any query, you can ask. Is there any query?
No, thank you.
Okay, then
Thank
have a
you.
good day and keep your spinal cord straight, keep it healthy, and have a good weekend.
Thank you so much.
Okay,
Have a good
bye-bye. See you.
Bye.